I'm going to go ahead and get started. And this meeting is being recorded today. So I'm going to go ahead and get started, and I know people will join as we move on today, but welcome to the Building and Managing Talent Pipelines in Healthcare, co-hosted by the NC Chamber Foundation and the NC Center on the Workforce for Health. I'm Meredith Archie, president of the NC Chamber Foundation. Before we get into the meat of today's discussion, we have a few house rules that I'm going to go over. First, all attendees are muted to avoid any distractions during today's presentation. And if time permits, we will answer as many questions as possible at the end of the presentation. And if you would like to submit a question during the meeting, please use the Q&A box, not the chat box. And then third, the recording of today's webinar will be made available to you via email within 24 hours of today's webinar. And that's it. So let's go ahead and get started. To get us started, myself and Hugh Tiltson, Director of NCAHEC, will provide some overviews of our organizations and some of the conversations that got us to where we are today. And then we'll move from there through the presentation, and we'll get to hear a lot about the Talent Pipeline Management Program, what it looks like in other states, and how it could work here in North Carolina as we look at our workforce in healthcare and different solutions that are available there. First, I'm going to open up by talking a little bit about the NC Chamber Foundation. Last spring, we launched our Institute of Workforce Competitiveness, and this was really in response to the incredible and urgent workforce needs of our employers across the state. We continue to hear from our employers that workforce is their number one issue and really what's keeping them up at night. So we launched the Institute for Workforce Competitiveness really to advance long-term strategy and policy solutions around workforce and talent-related issues. Our focus is on accelerating talent outcomes by deploying talent pipeline management for key industries across North Carolina, building workforce development leadership capacity to develop and implement workforce solutions and partnerships at both the state and local levels. And really through this work, we'll identify and recommend policy innovations to close the people and skills gap here in North Carolina. Importantly, what I want to really stress here is that the Institute for Workforce Competitiveness has a strong bias for action. And the Talent Pipeline Management Program, which you'll hear more about today, really provides a vehicle for action. And by working with strategic partners like the NC Center for the Workforce of Health, employers, educators, and other local partners, we believe this is an opportunity and an approach that could really deliver significant value and outcome-based results to the entire state's healthcare ecosystem. So we're excited about the opportunities ahead of us and the opportunity to work with all of you and to get into our discussion today. But next, I'll hand it over to Hugh, who will provide us an update on the work at the NC Center for the Workforce of Health.
Thank you, Meredith. First of all, good morning, everybody, and happy Valentine's Day. I hope you all remember that today's Valentine's Day. I had to get a reminder on my way into work, so figure I'm going to share the love with everybody. I get to be the initial spokesperson for you today about the Center on the Workforce for Health, but I want to start by emphasizing the importance of the partnership that goes into this. So I'm with the Area Health Education Centers, AHEC, and we are proud to partner with the Institute of Medicine. You'll hear from my colleague Kathy in just a little bit, and the Shep Center on Health Services Research, all of which have had our fingers in the pie of health workforce development for years. And we realize that although there's a lot of really good work going on and has been going on, typically and frequently that happens in silos and in fits and starts. And if we could come together to try to figure out a way to help those issues persist over time, that would be a huge contribution. So we came together and are setting up the Center on the Workforce for Health. It's a new organization, and we're still co-creating it and working through all kinds of issues. But ideally, what we want to do is develop, deploy, monitor, and assess efforts to address health workforce issues, and eventually get to what we call the Workforce for Health, because we recognize that today's healthcare workforce needs might be different from the needs of the population in the future as we're producing health, not just responding to healthcare needs. So that's how we came up with the name. To do all that, we're going to synthesize data and policy, and like Meredith said, with a bias for action to help not only our acts, but also help our partners and collaborators act through providing technical assistance and guidance to interested parties, and having a forum to share those best practices and lessons learned. We recognize that a lot of these efforts are going to take time, but there's a lot of good stuff going on. So if we can share all that, then we can leverage that work now to try to move things forward even more quickly. A key component of that is going to be coordinating those local and statewide efforts, those bi-directional actions, communications, and learning. And to do that, we had a number of conversations with a number of people, and this notion of talent pipeline management came up as a way of catalyzing local informed, data-driven, intentional action. And so we're very excited to work with the Chamber Foundation to learn more, to figure out how best to deploy that, and to accomplish these overall persistent needs, not just through statewide action, but through coordinated local action. And so we're here to talk to you about where we are with our thinking and get your feedback on it as we move forward. So enough about the center. Let me turn it over to my colleague, Kevin Fitzgerald, who will run us through some data with our other colleague, Kathy.
Great. Thank you, Hugh. And good morning, everybody. If we could advance the slide. So there's a lot of important work underway, and there's a lot more ahead of us. Across the state, there's a emerging set of partners that are intentionally focusing on healthcare workforce issues that include the North Carolina Institute of Medicine. You'll hear today work being done with the North Carolina Chamber, and there'll be local chambers of commerce across the state, working with Department of Health and Human Services, North Carolina Department of Commerce, colleagues across the university, including and multiple universities, including Sheps Center at UNC, as well as the community colleges. We've got good data, state level data on many of the healthcare jobs. An example, we've got the third iteration of the Sentinel survey to employers about what they see are the key needs. We also are been working on identifying associated with nursing. But there's gaps in our information. If you take the slide back, please, gaps in our information. We're not capturing all of the positions. Some of the positions that are not licensed are not necessarily included, and we don't necessarily capture all of the local needs. We lack a targeted awareness of local supply and demand for many of these critical healthcare positions. While we may kind of have statistics about the openings, we don't necessarily are able to get to the actual jobs themselves. And this aggregated understanding often hides some of the needs in local communities. And unfortunately, we're often reactive to the need and not anticipating the need. My colleague Kathy Koval is now going to talk about some of the specific data issues going forward.
Thank you so much, Kevin. And thank you also to Vincent and our colleagues at the NC Chamber for helping us to focus multiple sectors and to focus our attention on the health workforce. So Kevin and I, when we were planning this, we said we're going to keep our remarks as short as possible because we are so excited to hear from our colleagues from Vermont and Kentucky about their work with TPM, with talent pipeline management. But before we do that, I do just want to share some data with you. Some of you have seen this. If you haven't, it's really wonderful information that was compiled and analyzed by a colleague of ours, Colleen Tapin at the North Carolina Department of Health and Human Services. Before we dive into this, and this is a really interesting slide, so you get some chance to hear me, but also to look at this information. I do want to note a key issue that's reflected in the story behind each of these slides. While we're focused today on pipeline, and appropriately so, we do understand that our comprehensive solutions in North Carolina will focus on both a robust pipeline strategy and that effective retention. The North Carolina Institute of Medicine, where I'm the president and CEO, recently published 2 reports from our task forces, one on pandemic preparedness, another on the future of local public health. And those task forces brought people from across North Carolina to talk, and they had a lot to say about workforce, what the concerns are, and what are some paths forward. I'm going to put those links in the chat after I finish discussion, but I do want you to know that both of those have extensive attention to workforce needs for our healthcare and public health workforces coming out of the pandemic. But a huge part of the lesson was that our shortages and our concerns started well before the pandemic. So just to give one example, from 2009 to 2019, our public health workforce in North Carolina saw a decrease of 18%, so almost a fifth in the staffing per resident ratio for our public health workforce. So unfortunately, we entered into a pandemic probably without the resources that we need there. But of course, we saw that workforce respond heroically. But like many of our sectors in healthcare, they're now facing a lot of burnout, resignations, retirements, and morale. These are tough jobs, and we've seen people respond in different ways. From our colleagues at the Shep Center, they have noted that many nurses left the workforce during the pandemic, but many have returned, but not necessarily back to our hospitals and our long-term care facilities, which still face extraordinarily challenging shortages. All right, so I'm going to just focus in a little bit on this slide and what you're seeing here. This is from HRSA, the Health Resources and Services Administration. This is plotting supply and demand now and in the future. As Kevin mentioned, not every single sector is on here. Critically, we don't have direct care workers on here, but what it does show us that now and in the future, we see a big gap between supply and demand, this lower left-hand corner, in nursing, behavioral health, and primary care physicians. If we look at the next slide, Kevin alluded to this. This is the Sentinel. This is an employer survey, and the North Carolina AHEC and the Shep Center began surveying employers about workforce needs. I'll also put the link to the Sentinel findings. That website where you can go includes both survey responses like this and comments that really help you to understand the story behind the story. And when you go in and read those comments, you hear a lot about the difficulties of competition between urban and rural areas, between sectors in healthcare that may pay more than the other, and then many people leaving for sectors outside of healthcare. And then a reminder that this is a sector that relies heavily on reimbursement rates set by government payers through Medicare and Medicaid. And we're noting here on this slide, which is about the question about exceptionally long vacancies, of the needs for nurses and direct care workers across all of these settings, right? Those being the top areas with the consistently long vacancies. And then noting also other areas of healthcare that we might forget sometimes, like environmental services, and the importance of that and the strain that it places when we have long vacancies in those areas. In the next slide, and this is the last one I'm going to show, we're so fortunate in North Carolina to have I believe it's the nation's longest running health professions research center. That's right here at the University of North Carolina at Chapel Hill through the Shep Center. And this is one of the analyses that's available through their NurseCast. The North Carolina NurseCast projects that by 2033, North Carolina faces an estimated shortage of nearly 12,500 registered nurses and a little more than 5,000 LPNs, with the largest shortfalls in hospitals, nursing homes, and assisted living facilities. So I want to recognize that this is sobering information. Nothing that I've told you in the last 3 minutes is the kind of things that we want to hear on days that are all about roses and pink and hearts and flowers. But at the same time, I'm also very hopeful and grateful. And this is the reason why we're here, because we face these challenges. And in response to this challenge, as Kevin mentioned, all across North Carolina, teams have been coming up with innovative solutions, and they've been, and we're here today to learn about another idea and to understand how that TPM model would be organized, what we would expect if we can move forward with implementation here in North Carolina. So I think, Kevin, I'll just take us through this last slide and then we'll go right into Vincent. We just want to note that this alignment of effort that is a part of the TPM framework feels really important and a good step forward here in North Carolina, bringing the data that I just shared with you local and hyper-local, and taking a really systematic approach to aligning demand from employers and supply from our education educational institutions is part of why we've been so attracted to learning more about the TPM model. And with that, I want to turn it over to Vincent, who's going to help tell us a little bit more.
Hey y'all, thanks Kathy and Kevin for this context and discussion. A bit about me, I'm Vincent. I've been working in the talent space for a couple of years now, and I came on board the NC Chamber Foundation in January. Before we get into the meat, I'm going to provide a quick overview of TPM, or Talent Pipeline Management, just as a level set globally about this program. Spent a lot of time traveling across the state and across the country to find the best ways to solving those seismic workforce challenges we're facing today. After doing that research, I can tell you just on the street today, TPM is that best approach out there. It's not another half-baked, well-intentioned idea to fix the workforce system. So why was TPM so eye-opening to me today? Well, as we've been discussing, we've largely lacked the framework to tie the pieces of our workforce ecosystem together. And that's largely due to the fact that employers have been a missing piece in our workforce development arena. And that makes sense when you have to look at how they partner with system stakeholders. They've been tasked with serving on tons of advisory committees, navigating a workforce ecosystem that's incredibly complicated. They have limited resources to build relationships with all providers of talent. And up until today, they haven't had a clear incentive to team up with industry peers. Now, when you add that with the fact that our educators are also in a very similar boat, we find that as much as we're all rowing in the same direction, communication and coordination is unwieldy, and that really hampers ROI-focused partnerships. So while we have a lot of great, fantastic, innovative programs in the ground today, oftentimes we just see those stories existing in anecdote. So what if there existed a better way? That's where talent pipeline management, or TPM, comes into play. TPM is all about reorganizing workforce systems around demand-driven, outcome-based solutions. By creating employer collaboratives and host organizations, the foundational unit of TPM, employer leadership is activated and demand-driven data is collected and managed. So with a well-positioned host organization playing the quarterback role in coordinating systems change, many benefits unfold. One benefit includes making better informed investment decisions when considering new or realigned education programs. The benefit I'm most attached to is this final one, where it facilitates local and regional solutions in coordination with statewide approaches. TPM really endorses, I'll say, that bottom-up approach to addressing workforce challenges. So what is TPM and where did it come from? It's the brainchild of the U.S. Chamber Foundation, and the successes it's been generating across states and regions is really transformational. Digging into the details, when broken down, TPM is a 6-step strategy that uses supply chain management principles to address talent challenges. So in strategy 1, we organize an employer collaborative. If you're going to address industry needs, you need industry to work together. So here, employers join hands and identify the most promising opportunities for engagement around shared talent challenges. Next, employers submit demand-driven job projections around those critical jobs to show where we need to be headed. It's one thing for one healthcare provider to say to an educator, I need 150 nurses by the end of next year. It's a whole other proposition, though, when all healthcare employers band together and show how many nurses an entire region needs. And that's exactly the kind of data that our educator partners need. And that's the kind of data that you can only get from employers directly. In strategy 3, we create a shared language to better communicate competency, credentialing, and other hiring requirements for critical jobs in ways that allow for employers to signal similarities or differences in their jobs. And that helps us provide a ton of clarity to talent providers on the types of content that we need taught. Finally, with strategy 4, we analyze the capacity of all talent sources and providers in the talent supply chain. And we look into potentially untapped sources to meet projected demand. And then finally, with strategies 5 and 6, now that we have all of our facts straight, do we then talk solutions? We zero in on the core issues. Is it program performance? Is it lack of access for learners and employees? Is it employee retention? Oftentimes we find it's all of the above. And it's only at this point do we then use a robust methodology to build, improve, and manage the talent supply chain to create a positive return on investment. So with TPM, how do we ensure that we're tracking outcomes? Well, with the data that we're collecting and the roles that we're all playing as educators, workforce partners, and industry partners, we plot that all out into this talent supply chain value stream. In doing this, we get to assess the strengths and weaknesses of our entire system. Ultimately, the goal is that all of these activities and all these partners are performing at their best to close the people and skills gap. And I'll just say this from personal experience too. Leveraging this framework, we really help to alleviate a lot of that traditional finger pointing that can occur between industry and education. So what are the benefits of TPM? We're not going to go through this line by line, but if you think about tapping into a steady, higher volume, reliable flow of talent coming in through education programs, the benefits are many if we do it right. Students get increased access to well-paying careers that are in their backyards. Employers make better hiring decisions to fulfill jobs and improve retention. And educators benefit from having hyper-relevant and high-performing programs. In a sense, TPM helps de-risk the educational and employment environment for all stakeholders. So I'm a nerd. I could talk your head off about TPM, but the real emphasis today is to hear about the amazing work that's been performed by other states using this TPM framework. So with that, I'd love to give the stage to Andrew, a consultant with the NC Chamber, where he's going to be moderating really fun, captivating discussion with two friends of mine, true doers and innovators who are using this approach to make the workforce better. Thank you.
Yeah, thank you, Vincent. And I have to say, I'm really kind of honored to be taking this position today and facilitating discussion with a couple of great experts from other states. Before I get into that, I wanted to just very quickly recap a couple of key points from what everyone was saying, because we're here today to really talk about employer-led efforts. And most importantly, what does all this mean for healthcare in North Carolina? You know, Hugh talked about persistent need. Kevin talked about the need for targeted awareness of local supply and demand, which I thought was a really critical phrase. Vincent was saying, this is the kind of information you get from employers directly, right? Employers collaborating is the center of what we're talking about today, and creating employer-led efforts and in healthcare. And so that's why I'm really excited today to have a couple of the foremost experts from around the country in forming employer collaboratives and using talent pipeline management in healthcare. We have Sarah Tracy, Senior Project Manager, TPM, Kentucky Chamber. Kentucky is probably the leader in creating a statewide talent pipeline management organization. Again, they have dozens, maybe more, I might be underselling it, of collaboratives, employer collaboratives in multiple industries happening around Kentucky right now. Mary Ann Sheehan, Chief Talent Officer at the Vermont Talent Pipeline, is really also a foremost leader in how do you pull together employers, gather the data that you need, and create solutions in workforce pipelines. So we're going to hear from the both of them today. I'm going to ask them some questions. Feel free to chat in some questions if you have them as they speak. But first up, I'm going to turn it over to Sarah to talk about the successes that have happened in Kentucky.
Sure. Thanks, Andrew. And thank you to Vincent and team and all for allowing me to be here today. I'm excited to share with you all about what we've been able to build here in Kentucky. I think, Vincent, we can probably go to slide 4 since you did such a great job covering the overview of TPM. I don't need to recap that. I am just going to highlight a couple of the different solutions that have been built here in Kentucky. And like Andrew said, happy to take any questions. Actually, if you'll back up one, Vincent. There you go. Okay, so we started TPM here in Kentucky in 2018. So we've been going for a few years now. And we are a bit unique in a lot of other states and a lot of other folks that have been trained by the U.S. Chamber Foundation in TPM. It's kind of their side job, right? They have a different full-time job, and this is just a part of what they're doing each day. We were very fortunate here in Kentucky to be given the ability to have a statewide approach very early on, meaning we started with an executive director of our workforce center and then 5 full-time project managers dedicated to TPM across the state. So initially we started regionally. I live in Lexington, which is in central Kentucky, but I covered that area, the Cumberlands, which are just south, and then eastern Kentucky. And we had 3 other regional project managers and one that was statewide in our equine industry because it just spans the state. We now are statewide, all of us, and I lead our healthcare efforts. I'm very honored to do so. It's such an incredibly important industry. So across this time, since 2018, we have lifted 8 different regional healthcare collaboratives, 1 statewide in the long-term healthcare space. We have over 72 healthcare employers involved. We have evaluated, as Vincent discussed, demand for over 52 unique jobs within the healthcare industry. And currently we have roughly 20,000 healthcare openings across the state through our TPM demand evaluation. Next slide. The first collaborative that I'll talk about a little bit is the Healthcare Careers Collaborative of Greater Louisville. That is our largest urban area in the state. And these are their demand projections, just sharing them with you. This is aggregate information. They started by just evaluating RNs. And then as you can see, they actually kind of came back after looking at those numbers and seeing how great they were and saying, no, we have to understand this a bit further. Let's break it down by specialty. And so they redid their demand projections. And we all know giving employers a survey, it's not always their favorite thing. So I think the fact that with multiple collaboratives in our state, we've seen our employers look at initial data and then go, no, we need to dig deeper and ask for another survey to better understand their needs, has been a really, really neat experience for us. So as you can see here, pretty great demand, close to 3,000 in 2 years. Next slide. And then when we evaluated the nursing school capacity, we were seeing that really in 2 years or even in a year, they were really close to meeting that need or exceeding it even. So the question became, well, where's the disconnect? You know, why do our employers in this area feel like we're not graduating enough nurses when really we are? Next slide. What we found was a disconnect in clinical rotation scheduling. So some were, you know, doing it on pen and paper. Some were doing it with a certain type of Excel. Some were doing it with a certain type of software. But the schools, the students, and the employers were not connecting in a unified way. So what we did is worked with a clinical rotation scheduling software called Castle Branch. We brought that here to Kentucky. And today we have almost half of the 4,000 students that should be connected so that everyone is speaking the same language. And it makes it a little bit easier for them to not only find those opportunities, but get scheduled and take advantage of those. Next slide. In the northeastern part of Kentucky, which is a little bit more rural, but close to our urban centers in northern Kentucky or Lexington, what we found was we were graduating enough nurses to meet the need of our employers, actually. But where was that disconnect? Well, they're leaving. They're going to those more urban areas where the pay rates might be a little bit higher. So how do we convince our students and our CNAs who want to become RNs to stay here? We built an LPN to RN upskill program to keep them in the area, incentivize them to stay with us. You know, we want our people to stay here. Next slide. In Eastern Kentucky, so this is another picture of some of that demand and additionally how you can break it down. When I originally started in 2018 with TPM, We have a web tool that we use through the U.S. Chamber Foundation, and it didn't have quite as much flexibility as it does now. As we've grown and evolved through our work, so has this web tool, which now allows us to look at new positions, retirement, upskilling, and either voluntary or involuntary turnover. So it really gives us a better picture than just new and replacement positions. So this is for our Eastern Kentucky, a very rural area, healthcare collaborative for 2 years. Next slide. I think I just have a different picture. Yeah, just to give you kind of a different picture of how we show this to our employers, how we illustrate it. Next slide. What we realized with this group is when we looked at their nursing school capacity, if you could enroll at the highest rate and graduate at the highest rate, they could meet, not only meet, but also exceed that need. The disconnect we found with our Eastern Kentucky group is they were enrolling 70 and graduating 35. They were enrolling 60 and graduating 30. So there was this massive drop in actual completion rates for our nursing students. And when we dug into that a little bit deeper, what we found is that they needed support. They needed wraparound services. It wasn't a disconnect around the clinical rotations like in Louisville. It was, you know, I got a flat tire today and I can't make it to school because I can't afford to fix it. Or I have a newborn. One of the directors of nursing at one of the schools actually told me, she said, you know, we have a student who on paper, it just looks like, you know, a general decline. Like the classes are getting harder and maybe she's being more challenged. She said, and then I saw her in the library with her newborn. So what we realized is we needed to better connect them to wraparound services. So our local workforce board in the area applied and received a $2.5 million Department of Labor grant to do a lot of different things. But one of the most important things they're doing is career navigation and supportive services. So this is kind of statistics on where they are with that grant today. Next slide. And finally, the really cool thing that we've seen, because I've talked about them a little bit in their regions, is even though the solutions are regionally specific, right? You're urban, you're rural, you've got different needs. What they want to do is learn from one another. They've asked us for that. So now we have held 2 different statewide healthcare summits virtually to allow to highlight some of these successes and allow them to chat and ask questions of one another. And we formed what we affectionately call the TSHAC, the TPM Statewide Healthcare Advisory Council. So we pulled one member from each of the regional collaboratives together, and we use them as sort of that North Star. Where do we need to go next? What do we need to focus on? So even though there might be regional solutions, it's definitely a statewide effort at this point to learn from one another and see what we can build. I think that's it for me. Thank you.
Yeah, thank you so much, Sarah. And a couple of key things to note from that, you know, getting everyone speaking the same language, really, really critical. And also sort of the iterative nature of the process is how I look at it when you're talking about getting data a little bit at a time from employers. So we'll talk more about that in a little bit, I'm sure. And now I'm going to turn it over to Mary Ann to talk about some of the successes in Vermont.
Hi, everyone. Happy Valentine's Day. I'm Mary Ann Sheehan. I work for the Vermont Business Roundtable in Burlington, Vermont, which is actually a statewide organization. These are a few of my partners who I work with: Vermont Student Assistance Corporation, Vermont State University, CCV, that's our community college. But for the most part, what I want you to take away from this discussion is the value of collaboration. I can't say more about collective impact than the value of employers working together to change the trajectory of how these things work. You know, having worker-centric solutions for people who go into the field is really pretty important. So having authentic employer demand is really what Talent Pipeline is all about. So I've got a talent pipeline in healthcare going since 2018. We did our first needs assessment summary. We asked employers to participate, and at that point in 2018, we had about 32 healthcare providers who were part of that. They voluntarily wanted to be part of a solution where they worked together on this. By 2021, we had 67 employers who were participating. Oh, go to the next slide. You're good. So this is what we call our talent pipeline career ladder. We identified with our employers that nursing across the career pathway was really the highest demand for the state of Vermont. We have about, and I like to put this in perspective. So Vermont is a rural state. You can see my background. This is actually what it does look like today. The sun is out, the snow is on the ground, but we have a rural state. We have about 625,000 people in our whole state, which is really about the size of a region in another state. So we have a statewide model, and we have about 14 hospitals. We have 10 visiting nurse associations, and we have a fair number, 60 some residential care facilities who are interested in working on this together. So what we've determined is we need about 6,200 nurses across the career pathway. About 2,600 of those are in the RN category. So what I like to point out here is we have a nursing apprenticeship program that was employer-led. Employers asked if we would put this together for them, but I'm going to point out that the nurse assistant was a really high-level, not high-level, entry-level role with a high demand. So we have people who were starting in careers. These are 2021 wages, but people who were starting careers as nursing assistants getting paid about $16 an hour, who could take a health science core of prerequisites and then take a one-year practical nurse program, which was 35 credits, and move to $26 an hour with just that 1 year of education. And then with a second year of education, you could get your associate's degree, registered nurse, and make about $36 an hour. This is where we were focusing our solutions on. So with this apprenticeship model, effectively, what we're trying to do is attract new people to the LNA role. Some people call it CNA, we call it LNA in Vermont, but attract new people to the LNA role so that we could create this pipeline and keep it coming with people who already work in Vermont. So we have a real worker shortage. I don't think that that's unique to our state, but we also have a pretty low influx of people coming. So what makes it sustainable? We have practicing clinical educators who are working in hospitals, who are helping expand the number of students that our education system can take on. So we learned that we needed about, I said 2,600 RNs, which is about 1,300 a year. And we were only graduating about 350 in our 4 programs in our state. So if we were able to use practicing clinical educators, we could actually expand the number of people that we could take on so that the faculty could teach more people in classrooms, and then the hospitals could take on the clinical instruction role. We also involved a number of organizations in wraparound support services, and we heard Sarah talk about that before. These are probably the most important features of this model, the wraparound support services. And then we also have a sustainable financing model, which uses loan repayment. So our employers are actually using a self-funded loan repayment model, repurposing tuition assistance to do that. Next slide. So this is effectively what the loan repayment model looks like. If you look at the first line, employment, they're working as an LNA for 2 years while they're becoming educated in the health science core prerequisites in the LPN program. And then the employer is actually paying back their loan over a short-term period of 4 years as opposed to a 10 or a 15-year student loan. So this is actually a talent finance solution that helps employers reduce their risk to paying tuition assistance and having people leave. We're asking the people who are part of the apprenticeship program to sign an employment agreement, which says that they'll continue to work for the organization for 3 years after they attain their RN. So this is sort of a picture of what that looks like. I don't know that our LPN program is all that unique, but it does offer 35 credits toward the associate's degree. So I think that that's a pretty special model that we have. Next slide. So we're asking employers to actually do a few things in order to make this effective. We're asking them to provide preparation for clinical educators so that they can work with the accredited institutions. We're asking them to provide paid release time for the apprentices who are in education so that they can do it during their regular hours, meaning if they're taking 10 hours of coursework, they would be working 30 hours in the hospital. We're asking them to set up a loan repayment fund for sustainable recycled loans, and then also to provide wraparound support coordination for the apprentices. We've also added a DEI support to make sure that we can get people to the qualification level so that they can be effective in education. That's actually been more effective in a year 2 strategy. So most people are trying to just get it off the ground. We have 5 hospitals who are implementing this year. Each one of them has a 10 student cohort. So I'm going to stop there and let Andrew field some questions.
Yeah, thank you, Mary Ann. That was really great. And what we're seeing is really examples of success in solutions building from just a couple of leaders in bringing employers together. And I see there's a couple of questions in chat. I have some that I'll try to work in. I have some questions, and as we go and have this discussion, feel free to keep chatting in other questions, and we'll try to incorporate them as much as possible. I actually wanted to throw it over to Sarah first. I had a question of when you bring employers to the table in this collaborative way, how does that change the discussion around things like pathway building or wraparound services, employers, employee-centered things? So, when you bring the employers to the table, how does the discussion change around these things?
Yeah, Andrew, that's a really great question, especially, when we started in 2018, even across the nation, TPM was still a lot newer back then. So it was a little bit more theory. We were pitching this idea and we didn't have a whole lot to back it up with. But what we've seen here is, or at least what I've gotten to personally experience in Eastern Kentucky in particular, is that collaborative group of employers was actually brought together by a congressman. He brought them and the education partners together and said, we've got an issue, fix it. And this was before I was even hired with the Kentucky Chamber. So he handed those efforts off to a nonprofit in Eastern Kentucky called SOAR. And even they were like, we don't really know if we have the capacity to do this, to administer this. So it was really great that we were able to make that connection and say, hey, I'm here, I'm a facilitator, let me facilitate this work. But when you bring them together and you have this group of employers that essentially are competitors or have been in the past, it was neat to watch it unfold where they go, you know what? We're not fixing this on our own. We've been trying for years. We've been trying for a very long time. Let's try this and let's see what we can do. And as they dig into the data, as they get into their homework, as they better understand the issues, in particular in Eastern Kentucky, that wraparound service piece to get those students across the finish line, it just turns on that light bulb and they're like, oh, we've got to work together. We've got to make sure that we're supporting the students in Eastern Kentucky. We've got to make sure they're getting to that finish line, however that needs to be. It's just painting that picture, being able to paint that picture for them has just seemed to unify them a lot more than, they have been in the past.
That's great. And Mary Ann, I'm glad you talked about in 2018, Sarah, because there was a question in the chat really for both of you about how did you get going so early on this? And Mary Ann, I'd love to hear from you as well on how it got started. And then in particular, how do you overcome the challenges of getting that data sharing, right? And how do you overcome the challenges of having employers working together? I know you've been doing it for a while as well.
Yeah, so that's a really good question. I think, we actually have been collecting data. I'm glad we started in 2018, now that I think about it, because if we were trying to pull a group of employer leaders together, it would be really hard to get their attention at this point. And 9 of our 14 hospitals are operating in the red right now. So, and I don't think that that's unique either. It's, people they just don't have the capacity to work beyond what they're doing. So organizing back then, we asked an industry champion from one of the larger hospitals to invite people to come together. And we invited senior leadership and got the buy-in at that level, which I think is pretty important. Now, the level that we work at involves a variety of stakeholders within an organization. It might involve the chief nursing officer, HR vice president, just to get, started with, yes, we commit to doing this work together. So.
Yeah, that's great. And we had a question come in as well, Sarah, for Kentucky, that Kentucky has a really strong P20 system, and wondering if that plays a role in the TPM effort, and what are barriers or facilitators to accessing data, in relation to that.
Sure. So full disclosure, I had to Google P20 system. I didn't know that reference, but I'm assuming that you're talking about our data system, like our KY stats in particular. And so, yes, we have one of the, in my opinion, the best data system in the country. They're just phenomenal. The really thing that we found is, seeing that is longitudinal data, and a lot of their projections are like 5 years kind of thing. One of the neat things that we found really early on, again, with the Eastern Kentucky group, they were just like they were a dream team. They still are. When we looked at the demand projections that we gathered through TPM, through 7 employers, right? And a couple of them are major hospital systems, so large employers for the most part, but some small. 7 employers in the Eastern Kentucky area overshot with 2-year demand projections our 5-year data numbers for the state. So what that told us was, okay, we've got this real-time data, what do we do with it? And so now we actually do, we partner with KY Stats, and we actually give them our aggregate data twice a year. I'm actually submitting it later today for January. But so we partner with them, and that way they can make better informed decisions, or make sure that our workforce dollars are being spent in the right way and where they need to be. So it's been a really great partnership. They even were able to, utilizing the different employers that we have, develop a dashboard and evaluate retention among TPM companies or non-TPM companies. And the retention is better with those companies that are participating. So it's been a really great partnership. We love working with them, and yeah, we're using our real-time data to feed our data system and better inform our state's decisions.
Yeah, that's great. And I think you're hearing real examples of how you take kind of data that you have and use employers and make it even better and make it more actionable. And Mary Ann, one thing I was curious about, you were just saying about, it is a challenge maybe right now to pull together healthcare employers. And I was curious for you in Vermont, and given what you said about the size of Vermont, and maybe it's even like a region in other states, like what is the leadership structure of a healthcare collaborative? Do you have co-chairs? How do you have employer champions? Kind of how is it structured? How should people be thinking about pulling together a collaborative effort?
Well, when we started in 2018, we had a CEO industry champion who everybody knew in our state. But shortly after that, he said to me, people don't want to hear from me. We're going to talk about nursing. They want to hear from the chief nursing officer. And so we have an organization called VAHS, which is Vermont Association of Hospitals and Health Systems. And I organize a group of chief nursing officers and HR folks from VAHS to talk about these issues. So we have a once a month meeting, and Workforce is just part of that meeting. But you know, that's where I actually have the meat of the work getting done.
Yeah, that's great. And something you said about kind of, you know, they don't want to hear from the CEO or having the CEO leadership to start. You know, we have a question in the chat about nurse educators, and you know, how do you find enough nurse educators? And I wonder for either of you, I imagine this is a challenge around the country, but is that something that has had to be addressed in your states in terms of the number of nurse educators available?
That's our biggest barrier. And just couple that with union wages for faculty. And you know, we have like the perfect storm. Here we have people who are starting to teach nurses, and they have to have a master's or a doctorate degree in order to do so. And they are being paid like $50,000 a year, where the associate's degree nurse can graduate and make $85,000 in practice. So, you know, what's wrong with this picture? We need more people who can teach. And if they're not going to be a faculty member, we want to be able to at least to make a joint appointment where they can work and also teach. You need to have some pretty significant chops in order to teach. I mean, even in clinical, where you're showing people what you do, some of these people have been associate's degree nurses working in the field for 15 years and are experts, and they can't show other people what they do in clinical. So it's just, you know, a lot of things I think have to change. These are all like policy type accreditation, you know, solutions. So those are all things that I expect will probably make some modifications over the next few years.
Yeah. Sarah, anything to add on that?
I think Marianne hit the nail on the head. We're facing those same challenges. It's really tough right now, and yeah, I think there are going to have to be some big changes that make that happen. I know in any industry here in Kentucky, we're looking at the retirement piece as well. Someone who's been maybe in the hospital for the majority of their career and are ready to retire. What does that look like? Can they teach part-time? You know, I mean, even part-time is one more teacher than we have right now. So kind of looking at what that looks like. But yeah, unfortunately, you know, we don't have a solution in place for that yet.
And you know, I was curious, and relating to another question I had for Sarah or Marianne, either of you. You know, we have employers on this webinar today. We have a kind of a cross section, I think, in healthcare, but particular for employers. You know, what do employers learn about the healthcare workforce marketplace, kind of beyond themselves? You know, by participating in collaboratives, and you know, what do they learn about the marketplace that's of value to them? And I know Vincent down in Gaston with manufacturing has really experienced that with manufacturers, but kind of what do they learn about the marketplace by participating in a collaborative effort?
I'm just going to say that they learn from each other. I mean, that we did some research on why people participate in Talent Pipeline. That was the #1 answer. They learn from each other. Best practices are developed over time. And when you hear of someone else who's doing it, you know, regionally, these hospitals are trying to accomplish the same thing. It's not necessarily a secret. You don't have a ton of reasons why people would want to keep that stuff to themselves. So when there's a good solution, we're like learning from each other. And that's really the most valuable piece of the work that we're doing. I think, with the shortage that we have also, we talk about things like quality of care and what that looks like, hours of operation being cut, hospital census filling up, emergency rooms with long wait times, things like that are, it's very difficult for everybody. And so there's definitely a need to come together.
Yeah, I would add to that. I would echo everything Mary Ann said for sure. They, like I said, when I was presenting earlier, we have formed a statewide healthcare advisory council for just that reason. I very early on in the pandemic was talking to one of our healthcare employers in Eastern Kentucky, and I said, "Oh, over in Louisville, they're doing this right now." And she said, can you send me his phone number? I want to talk to him. I don't care if they're urban and we're rural. Right now, we've got to innovate. We've got to learn from one another. We've got to work together. We've got to figure this thing out. And that's what spurred those statewide summits and the advisory council. But additionally, I would say it's been kind of fun to watch. I've gotten to see our healthcare employers get more innovative and try new things, try not just something that they've seen someone else do, but just try something new and really get creative with how they're trying to help their employees stay with them and be motivated to stay in the industry. So it's been pretty neat to see that side of things. And I don't see it in a competitive way at all. It's just more, let's get creative is what they've kind of started to say.
I think that is a wonderful way to close out the panel or the thoughts from both of you on that subject. And because I think it's a reminder, and I'll hand it back over, that we have a process. This TPM is a process. It follows strategies. There's so much behind it. In the end, it's about bringing people together and working collaboratively and finding innovation together. And I think Mary Ann and Sarah really appreciate you capturing that for us and showing how it has created solutions in your state and how it has worked well specifically for healthcare. So thank you to both of you for joining us today. And I'll hand it back to Vincent or Meredith.
Back over to me. Thank you, Andrew. And I want to echo Andrew's sentiments there and thanking Mary Ann and Sarah for sharing their experiences in Vermont and Kentucky. And it was just incredibly illuminating to me to see how, bringing together, I think that the word collaboration, and Mary Ann said it best, with collective impact, it's just so incredible to see what they use the data for, not only to help bolster the talent pipeline, but to create new solutions for retention, wraparound support, these worker-centric solutions, just to make it a better place for their employees to work as well, and driving innovation at the employer level. So I loved all of the different themes that Mary Ann and Sarah touched on today, and I thought it was incredibly valuable. I want to thank everybody for attending today's webinar. I know we're all busy, and so I appreciate you taking your time out to learn a little bit more about Talent Pipeline Management Program, what it looks like in healthcare in other states, and be thinking about what it could look like here in North Carolina. One thing I do want to mention is we have a survey at the end of this webinar, and we would love all of your feedback on there. I talked about action earlier, and ultimately we want today's conversation to move into action, and we know data plays an important part in that. So we asked our healthcare employers to please fill out this high-level talent needs survey, and if you're not a healthcare employer, there'll be a link within the survey that will direct you to a separate one as well. So with that, I will hand it over to Hugh, but again, just want to thank everyone here again. Ultimately, our intention at the North Carolina Chamber Foundation and the NC Center on the Workforce for Health is to continue to collaborate, develop more partnerships, and continue to move this important work forward. So Hugh, I'll hand it over to you.
Thanks, Meredith. I know I have less than a minute, so I'll be brief. Again, let me reemphasize the thanks for Mary Ann and Sarah. We've certainly learned so much. For those of you who participate in the North Carolina Center on the Workforce for Health meetings, hope you found this responsive to your desire to learn more about how TPM can actually apply in healthcare. And I hope you're leaving, like I am, with a sense that this is a great opportunity for us to catch up with Vermont, Kentucky, and then take the lead on in other areas. So I appreciate everybody making the time, look forward to continuing the partnerships, collaboration, and moving towards action so we can help to address these really pressing, timely, and persistent problems. And I'm grateful, Meredith, for you and your team's partnership and collaboration as we figure out how to do that. So thanks, everybody. And I think we have one more slide, don't we, about next other meetings, or did we take that out? Gotcha. Just wanted to make sure you guys know some other things that are coming up, and you can add those to your agenda and your list for other future events. Thank you, everybody. Happy Valentine's Day.